Hi, this is Dr. David Klein at the Stages of Life Medical Institute in Longwood, Florida. What I'd like to talk about is returning to work and the value of PPE, Personal Protective Equipment. Okay, that's an acronym that none of us used before the COVID virus. COVID is another one that nobody ever used either. My first case that I've seen of coronavirus was 2 years ago, right? So this has been an eye-opener for me. Now, with 40 years of experience in medicine, I have very often used masks, little surgical booties, the hats, the gloves. These are all the things that we would use very customarily in the practice of medicine. They're protective, personal protective equipment. Who do they protect is the better question. Do they protect you, the user, or do they protect the people around you? And the answer is yes. Okay? But there are realistic expectations here. Okay, the most important realistic expectation is this mask, okay, any different or any better than the spacesuits that you see at the CDC when they're dealing with really very virulent things like Ebola and hantavirus, and there are a number of others that are just nasty things. You end up with a little crack in your suit and you're done, you're toast. You'll be peeing blood and then you die. Okay, happy days. So what does it take to protect you? And the answer is, you need to be able to protect yourself from a sufficient inoculum to get sick. And that is measured, actually, in certain organisms that we know well, like salmonella. It may take 100,000 salmonella organisms to make you sick. It may take 10,000 Shigella to make you sick. These are the sorts of things that we know very well. Certain viruses, it may take 10 or 20,000 or billions of these particles to make it past your defenses. So really the rate limiting step is that the physical barrier, whether it's your skin, whether it's mucosal membrane, whether it's your eyeglasses, or whether it is a pair of gloves. So these things are there to protect you from the environment and to protect the environment from you. So there you are. You're going to walk into the grocery store and you've got your little mask on and you're feeling protected. And if you're really cool, you'll have a pair of latex gloves. Probably the same ones you had yesterday, right? Or the day before. And so in the process of putting them on, you just soiled your hands from what you touched yesterday, unless you take certain precautions and understand what you're doing. So every time you touch something with your hands, it touched something else, it's a game of tag. Now, how much virus, how much bacteria is transferred subsequently? And the answer is it drops off logarithmically. That means fast, okay? It diminishes very quickly. So if you go ahead and you cough into your hand and you go shake somebody's hand, that's a pretty substantial inoculum you're about ready to give somebody. If it's a personal friend of yours or a personal friend of somebody else and you kiss them, you're going to give them a certain amount of inoculum depending upon your technique, as it turns out. You can deliver more, you can deliver less, really beyond the scope of this discussion. So what does the PPE do for you? The mask protects you from coughing particles or sneezing particles any distance. Is it 100% protective? The answer is no. It provides 97, 99, 95% protection from other people as well as protection from other people. The gloves do very much the same sort of a thing. But unless you understand very carefully that nothing is going to protect you if you're wearing gloves and you touch your face, that's a real problem. It's very hard not to do that when you wear eyeglasses now, is it? Okay, those of you that are reliant on these things understand that every 2 minutes you're pushing your eyeglasses up, you're getting your fingers close to your eyes, and that's a problem. When you're wearing a mask, it's even worse because the water vapor blows up into your eyeglasses. That is just life, and it's going to be that way until this is over. So, you're wearing a pair of gloves, are you? So you make it home, you actually wash your hands with the gloves on. Okay, does it take anything special to do this? Do you need special hand sanitizer? No, actually, soapy water does the job. And then you peel them off and let them dry. Wouldn't you know? Here in Florida, you can take them and put them outside. You allow them into the sun, and it will kill just about anything that's on the gloves or in the gloves. It's not a bad way to go. It's called air drying. Okay, your grandparents, great-grandparents used to hang laundry out to dry. And you know something? It always smelled better. Okay, you can put those little fancy puffs in your dryer and you think you're doing something marvelous. You're killing the environment. You're probably not doing yourself any favors. You allow things to dry up. What about these masks? Okay, now, we ran out of masks here the first day and a half that this thing occurred because I was not smart enough to plan to have a bunch of masks. Why? Because in this practice, we don't use surgical masks. I got out of the surgery business 35 years ago. I don't do that anymore. We do use gloves, so we have plenty of gloves, but no shoe covers, no gowns. This is a real problem though, isn't it? All right, so what do you need to do to protect yourself? Okay, first thing you want to do is to wash these things. So this one's cloth. This was made for me by my physician's assistant. Okay, why? Because she's watching me walk around as the only one without any mask on. So she thought this was appropriate. I had to agree with her. What else do you want to do? Okay, having these latex gloves is a really good idea. Do they need to be fancy surgical gloves? No, they just happen to be available much of the time. Do you need to use those ones for food handlers? The answer is they're perfectly adequate. They're cheap. Okay, you can use them and you peel them off and go on to the next ones. Do they need to be skin tight or tighter as with surgical gloves? The answer is no, they do not. You need to be keeping something in your car along the line of a Tupperware container that has soapy water in it. Why? Because when you leave the grocery store, you better wash your hands before you touch your steering wheel and your shifter. Or you can use these Lysol wipes and whatnot, and that's great. It works just fine, unless it's leather, in which case you're going to regret it this time next year. Okay, so I prefer soapy water. It works for me, it works for my car, because I like my car a lot. I'm not really crazy about wasting it or damaging it with bleach. It makes no sense to me. It really doesn't get you very much. What other protective equipment do you think you should be wearing? Okay, this is pretty important protective equipment. Why? Because it protects you from the same crap that you're trying to stop with the mask. So somebody looks at you and they're talking to you, where do the droplets go? They go down. They're going to hit you in the shirt, the trousers, and your shoes. So also protective equipment. So as you leave your car, as you get into your house, you take your shirt off, your trousers off, and then kick your shoes and you go about your business. You may want to change, you may not, depends on who you're living with. It all works. Change your clothes because the PPE begins and ends there. So I hope that helped a little bit, because as you go back to work, this is going to be more and more important. You have people around you, you're going to be sitting at your computer station, you're going to be sitting on chairs that have been occupied by other people. Think about the bus, okay? You go sit on a bus seat, okay? Do you have any idea how many people sit on that bus seat between cleanings? Okay, you go on an airplane, something I'm going to think about far more frequently now than I did before. So you're going to eat on that tray in front of you, the same tray that somebody 2 flights earlier changed their baby's diaper on. Okay, so the surfaces around you should be clean. So part of your PPE should be hand sanitizer. You keep it in your pocket, purse, wherever you choose to keep it. These hand wipes are really going to be very, very important, because you cannot rely on janitorial help to necessarily keep the cleanest things clean. This is Dr. David Klein, hoping, okay, that you remain safe as we return to work, because I'm depending upon you to do your job, just as you depend on me to do mine. Again, this is Dr. Klein. Have a nice day.